Good afternoon, everyone, and thank you for joining us. As we mentioned on Monday, our county's recovery is picking up steam, and we are already steadily moving to reopen all sectors of our society. It's happening so fast that since we last spoke, we added indoor movie theaters to the list of businesses that would be able to reopen on this Friday. They will have to limit the number of attendees in each theater to 25% of the theater capacity, or a maximum of 100 guests, whichever is lower. They must also ensure employees and customers practice good hygiene by using facial coverings when not eating or drinking, that they practice good hand hygiene, and that they maintain physical distancing and they're screened for symptoms as they come in. This is a very positive step, and I'm sure we're all looking forward to getting that giant bucket of popcorn, but let me remind you to check with your local theater first. Again, the guidance allows them to reopen, but some theaters may not be ready to do so by this Friday. Movie theaters are joining the list of businesses and activities that we already have announced can reopen on Friday. That list you see before you right now. It includes gyms, bars and wineries, swimming pools, including condominium and community pools, hotels and other rental properties for tourism and individual travel, card rooms, racetracks and satellite wagering facilities, family entertainment, including bowling alleys and batting cages, zoos, galleries, museums, and aquariums, and film and TV productions. I know the San Diego Zoo has already announced it will not reopen until June 20th. So again, check first before you visit any of the establishments on this list. Many of you have asked about other businesses and activities and when they can open. We have not received guidance on those. The easiest way to check is to visit our coronavirus website that's right here on the podium. It's also on the front page. You'll see a blue Safe Reopening tab when you get onto that website. You can click on that and it will take you to another page that lists what is open now, what is closed, and what is coming soon. This website is updated regularly, and of course you can check it out at any time. Let me update you on some more good news that we received since the last time we held a briefing. Yesterday, we learned that the Federal Emergency Management Agency has extended our Great Plates delivery program for another 30 days. The program was supposed to end on June 10th and will now run through July 10th. If you recall, this program was started in May to help seniors who are more vulnerable to COVID-19. The program partners with area restaurants and our County Office of Aging and Independent Services to deliver 3 healthy meals a day to older adults. It's a great program because it helps our vulnerable population while also assisting restaurants that have suffered economically from the stay-at-home orders. Since the program started, we have signed up more than 1,400 participants and 31 different restaurants. With this extension, we'll be able to help even more people. The program is eligible to people 65 and over who live alone or with another older adult and who are at higher risk of COVID-19. There are several ways to learn more about the program and sign up. You can dial 211 or you can call the area agency, the Aging and Independent Services call center at 800-339-4661. That's 800-339-4661 and select option 7. Or you can go online to www.aging.sandiegocounty.gov/Great Plates. Our thanks sincerely goes out to FEMA for extending this program through July 10th. And now to go over the informational charts, let me introduce Supervisor Fletcher.
Thank you, and good afternoon. I know that there has been a lot of excitement around the speed and scope of the reopenings, but I want to say on a cautionary note that the dangers from coronavirus remain as real today as they were in March. While we have done a very good job as a region in our initial response to coronavirus, and thus far in our reopening, in San Diego we have done well, there are 10 counties in California that have been flagged by the state for additional monitoring due to increases in transmission of COVID and or increases in hospitalizations. And while we are not one of these 10, this does tell us that there is an increase in transmission in a number of counties that are opening throughout the state of California, and it's a reminder to us of the need to be very vigilant and be very cautious, especially as we move into higher risk type entities that are opening. These increases are not just Los Angeles County. As of Tuesday, Orange County saw an average of nearly 400 people hospitalized with COVID-19, which is up 100 from where they were in May. Ventura County saw a doubling of their COVID hospitalizations from Friday until Monday. And while we are all in a much better position on PPE, testing, ventilators, hospital surge capacities, and other issues, we want to be mindful that in order to have a smooth recovery and reopening, we have to responsibly do it, and we want to continue to implore the public to please do everything you can to adhere to the measures and suggestions that have been put out and the public health orders that are in place. We're also mindful here in San Diego County that not every region of our county is being impacted the same. We have some regions that are seeing much higher cases and much higher hospitalizations and are being hit much harder than others. And so we're not out of this crisis yet. We still have a long ways to go, and we need everyone to be as safe as possible as we go forward. This will not only protect life, but this will protect our ability and give us the strongest possible chance to have a smooth and steady economic recovery as well. With that, let's jump into before we jump into our numbers today, a quick note on testing. For about the last 2 weeks, we've had challenges with getting the negative test reporting from the Optum drive-up or walk-up testing that the state of California has helped facilitate. The positive cases have all been contacted, and our incredible department and our epi labs are doing a good job of contacting them, notifying them, and contact tracing them, but it has impacted our testing numbers. So our numbers the last 2 weeks have not fully reflected all of the testing that has been done because we've had a little breakdown in the system in getting the negative numbers reported back to us. We expect that to catch up in the next 24 to 48 hours, and then I think we'll see a retroactive increase in testing that's been done. But did want to provide that information, and once we get those, we will share with you how many of those are reported and on what date. But let's jump into what we have for today. As of today, we're reporting 3,854 tests being done. Again, being mindful that those state drive-up testing are not included in these test results. For an average of 4,415, you see 436 contact tracers, and then our public health motel rooms under our treatment effort. For today's totals, we're reporting 108 total positive tests out of the 3,854. That is a 3% percentage positive. Again, you can see the orange or the purple line there tracking reasonably flat for about the past 2 weeks. Hospitalization daily census, ICUs down a little bit, non-ICUs up a little bit. Total COVID-related holding reasonably steady and flat. If we go to the next one, we can look at our COVID hospitalizations there at the bottom at 373, non-COVID, and you see an increase of just over 4,000, 4,019 for our total hospitalization census, as it is relative to that 80% bed capacity trigger that we've outlined. And then when it gets to ICUs, you can see the COVID-related ICUs down a few, non-COVID-related ICUs up a few. Yesterday to today, down a few, but again, holding reasonably flat. ICU bed occupancy at 66%. That concludes my section report. I'll now turn it over to Dr. Wooten for her Public Health Officer's report.
Thank you, Supervisor Fletcher, and welcome everyone for attending this media briefing today. Globally, nationally, and statewide, statistics are updated on a daily basis, and we draw from the database at the Johns Hopkins on their dashboard. And our information shared with you today was obtained about noon. Globally, there were almost 7.3 million positive cases, including over 413,000 deaths. Nationwide, the United States is reporting almost 2 million positive cases, now 27% of the global number, and includes over 112,000 deaths. Statewide, California is reporting over 137,000 positive cases, which includes 4,752 deaths. And today, the County of San Diego is reporting 8,837 cases, which is 108 more cases than yesterday, and this includes 305 deaths, which include 4 more deaths than yesterday. The average age is unchanged from 3 months of age to 102 years of age. The age range from 20 to 49 years of age is 53% of the total number at 4,697. In terms of gender, 51% of the total number of cases are female and 49% are male. And we have 1,447 cases that have been hospitalized, and this is 16% of the total number. And of the total number of hospitalizations, 410, or 5% of the total number, have been admitted to the ICU, and this number is 28% of the total number of those hospitalized. As of June 9th, the county has surge capacity for hospitalizations at 34%, and for ICU admissions also at 34%. Of the 305 deaths, which represent approximately 4% of the total number of cases, we have, again, 4 additional deaths reported since yesterday, and the dates of these deaths occurred between June 3rd and June 8th. The age range is from 27 years of age to 88 years, and 42% of those who have died were female, 58% were male. 291 had underlying medical conditions. This is 95% of the total number of individuals that died. And we have data for this number, total number of deaths, for 97%, or 295 of the 305 total, which means this is data for race and ethnicity, which means there are 10 individuals for which we do not have those data. Of the deaths, race and ethnicity includes 129, or 44% for Hispanic or Latino, 124 also for whites, 30 or 10% were Asian, 9 or 3% were African American, and 1 each is reported for Native Hawaiians or Pacific Islanders, American Indian, Alaska Natives, and one individual of multiple races. And as always, our sincerest condolences and sympathies go out to the family and friends of those that have been reported today and who have lost their lives since the COVID-19 pandemic started. And since the beginning of the COVID-19 pandemic in San Diego, there have been 101 outbreaks in congregate settings and community settings. Of this total, 45 or 45% are now closed or inactive, meaning that there have been no cases reported for these locations in the past 14 days or longer. Of the 101 outbreaks, 56 or 55% are still active, and these include 22 or 26% of the 56 in San Diego County's skilled nursing facilities. So 22 of the 56 are in skilled nursing facilities. 23 outbreaks are in non-skilled nursing facilities or other congregate settings. And 11 are in community setting locations. And as a reminder, community outbreaks are outbreaks in all other locations aside from the congregate settings. And these would include locations such as places of worship, schools, private residences, restaurants, business, and any other location that is not a congregate facility. As shared at earlier press conferences, the county is actively assessing triggers that may require modification to the health officer's order. And outbreaks is one of those triggers that you'll see here. We have three that we will look at initially as raising the alarm, if you will, that we need to pay closer attention to what's going on. So that includes outbreaks, which is number 2, number 7, ICU capacity, and number 9, which is personal protective equipment, or our supply of personal protective equipment. Today, all of these 13 triggers are green with a check, so that is good news, but we have to stay vigilant and continue to monitor these triggers very closely. Practicing good hand hygiene and environmental sanitation, maintaining physical distance when you come in contact with individuals outside of your household, using face covering, and conducting appropriate screenings are important strategies. And as we reopen our businesses and increase our activities, continuing to be vigilant and maintaining adherence to these 4 core strategies will be very crucial. Each one of us has an important role to play, and I encourage everyone to be responsible and adhere to the guidance documents that as they are released from the state. So with that, I would like to thank the public for all that they have done and will continue to do, and we will keep a close look at the 13 triggers because we anticipate that cases will increase as we are opening up businesses and activities. So now please welcome back to the podium Chairman Cox.
Okay, we'll go directly to the questions.
Danny Freeman with NBC7, please ask your question.
Thank you, guys. Good afternoon, all. The first question, I believe, would be best for Supervisor Fletcher. I know we're in good shape right now, but if the data says we need to start shutting things down again, is there any concern that politics could get in the way of dialing back?
Supervisor Fletcher?
Thank you, Danny. I think as Dr. Wooten has made clear and as we've made clear at the county, the decisions that we make here are based on the data, based on the science, based on the best practices. Right now, as you just saw, the indicators on the triggers are all green. There is concern about what's happening in other counties, but the situation we're in here remains in a generally stable situation. The triggers were unanimously approved and supported by our board, and all of the groups involved have all attested to those are the right triggers. And so if we were to hit a trigger, then we would take the appropriate action congruent and proportional to the trigger that was hit and the underlying assumptions of what led that trigger to move. And so I think everyone is aware of the situation we're in, aware of the path forward. And again, our hope is that none of those triggers ever hit and we continue on a smooth reopening. That's been the aim from the very beginning, and that's certainly what we hope will happen. But in the unfortunate event, that's why we have the triggers, to tell us there's a problem, and then we will take appropriate action under Dr. Wooten's leadership based on what the data tells us, what the science tells us, and what is in the public health best interest.
Thank you.
Okay, next question.
Brandon Lewis with CBS 8. Go ahead and ask your question.
Hi, actually. Thank you. I actually have 2 questions. The first one is for Dr. Wooten. Around Memorial Day, you had said that the next 21 days would be very telling on how our reopening is progressing and will continue to progress. Now that we're about 2/3 of the way through that period, I was wondering if anything has stood out to you or any other noteworthy observations that you've made since then.
Okay, Dr. Wooten.
Thank you for that question. Looking at community outbreaks is one of the important areas that we stay on top of to see if things are going on in the community that we would not want to occur. And while our trigger today, we've had 3 in the past 7 days, and this is a rolling 7-day average. We are seeing a bit of an uptick in community settings, so that's concerning. The question before is, if we see community outbreaks, if they are specifically related to restaurants or specific businesses or food industries or even churches, that is the opportunity to work with those various industries to make sure that their infection control measures are being implemented appropriately. So we are staying on top of that, but we are thankful that our triggers are green. But again, we cannot rest on our laurels, and we have to be constantly on top of what's going on with the number of cases, hospitalizations, outbreaks as well. Thank you.
Thank you. I just wanted to ask another question about Scripps, which announced that they're going to stop accepting patients from Imperial County to ensure that there are enough ICU beds and hospital beds for San Diegans. I was wondering if that's something that was done at the behest of the county in order to keep meeting the triggers that you referenced, and if not, whether the county has any opinion on that decision, given that available bed space is one of those triggers for the entire county.
No, I think that's an appropriate decision, and all hospitals have the authority from state IMSA that they can do that if they need to. So we agree with that decision, and we'll support that hospital as well as other hospitals that exercise that right to do so.
So it wasn't something that the county recommended?
Did the county recommend it?
Right, I'm just wondering if Scripps did that on their own, or if the county said they should do that.
No, the county did not tell them they should do that, but in consultation with the state said that they could, and therefore they exercised the right to do so. Thank you.
Thank you.
Okay, next question.
Morgan Cook with the San Diego Union Tribune. Please state your question.
Hi. So my question is, we have a lot of more types of businesses that are being allowed to reopen this week, but the county health order still says that people are required to stay home except for essential needs, visiting approved businesses, or participating in family activities outdoors. So does that mean that people can't go visit a friend in their backyard, even if they're 6 feet away?
Okay,
What does that mean for
Dr.
people to visit each other?
All right, Dr. Wooten will respond.
I understand, and thank you for that question. I understand that it might seem a bit contrary, but we are slowly opening back up. And the state is providing guidances for those businesses or industries that we are allowing to open. General gatherings at friends' homes or in the backyard for a barbecue, and we've had outbreaks related to those type of situations. We are not encouraging people to do that. We are advising against it, because when you have individuals outside of your households come together, there is the increased risk for spreading COVID-19. So we are slowly opening back up, but we are not, we are asking people not to gather at individuals' homes. Is there another question?
Okay. So do we have any timeline for when we can expect the stay-at-home order, for people to be lifted?
Well, that order would come from the state, so I don't have a timeline for that, but we are anxiously awaiting the guidance from the state. Thank you.
Okay, next question.
Lauren Coronado with NBC7. Please state your question. Lauren Coronado?
hi there. My question was actually already answered. Thank you.
Okay. I think we have one more.
Will Huntsberry with Voice of San Diego, please state your question.
Hi. I was wondering if you guys could provide a little bit of an update on the testing task force and the strategies that the testing task force is trying to implement now and may try to implement in the coming months if we have another wave. So specifically, I'm wondering, what is the current daily testing capacity? It seems to be around 10,000 tests per day from the organizations I've reached out to. And will we need to be doing more than 5,200 tests a day should we have another wave? I know that 5,200 mark is what you guys had identified based on the Harvard study, but it seems like we have much more capacity than that. Do we and will we use much more capacity than that in another wave should that happen?
Okay, Dr. Wooten will respond.
Good afternoon, Will, and thank you for your question. In terms of the capacity, county-wide, we have about a total capacity of about 13,000 tests on a daily basis, and that does not include commercial laboratories. And you get the numbers every day. Our goal is for stage 2 is 1.5 per 1,000 population, which is 4,950. And you've heard about some of the glitches we've been having with the state. We feel we are there. The next primary goal for stage 3, once we reach or go beyond the stage 2 target, is 6,600. And that is 2 tests per 1,000. Again, these are both metrics that have been prescribed by the state. So we are still trying to approach to get to that 6,600. But right now we are on average, I would say, about 5,000. And we will certainly be there when we get the glitch cleared up with the state. Now, in terms of, those are our targets for testing, that's our capacity, and then our targets. So, and we also have a prioritized list that has been disseminated in the past based on federal priorities, state priorities, and then local priorities. And always the priorities for our healthcare workers, first responders, or hospitalized patients. Those are priorities in levels 1 and 2, and then that transcends also to individuals in vulnerable populations, which includes the elderly, individuals with underlying medical conditions, and other health conditions. And rural areas, not only it is the individual, but also the geographic location, whether it's rural or our tribal nations, or targeting individuals from diverse racial and ethnic groups. So all of those are part of our prioritization strategy.
Right. Well, I think obviously the county deserves some credit for really increasing the amount of tests that were being done and hitting some important benchmarks that have been put out there in terms of per capita testing. That number, though, still does seem a lot smaller than, for instance, like South Korea, which has been brought up a lot as like the example of how to test, trace, isolate. Can you talk about it in comparison to that? And are there difficulties associated with having a complex healthcare system, whereas many other countries that have done test, trace, isolate and have centralized health systems? Could we and should we be pushing for more tests to do more of what South Korea's done, or is that just too difficult here?
You know, the systems are different, Will, so I can't speak to, well, I can't actually. It's a different system, so we can't compare. Comparing ourselves to South Korea would be like comparing apples to oranges. We are doing a great job locally. The state puts out a daily report on testing that's done throughout the state. And as stated earlier, we've had a few glitches with our state testing, but we hope that that is going to be resolved soon, and we will have full transparency to the volume of testing. And also, testing materials, you know, we don't make those materials, but we've done a good job in gaining access, particularly over the last several weeks. We have increased our capabilities significantly. So we think we're doing a good job, and we'll continue to do that until we reach our 6,600 target. Thank you.
I might add that we're working on a website. We'll have an announcement to make on Friday, which could significantly increase the availability of testing. So stay tuned for that on Friday. I think we have one more call-in question.
Elroy Spatcher with NBC7, please state your question. Elroy Spatcher? Did you have a question?
Okay, we'll go to the texted questions.
Yes, I'm going to start with a question from John Carroll from KPBS. At Mission Beach yesterday, the vast majority of people were not wearing masks. This included in adjacent businesses. Given the fact that our neighboring state is Arizona and it's in deep trouble, and as you mentioned, the rise in cases in neighboring Orange County, with all of this reopening on Friday, are you concerned at all about those spikes here?
Okay, Dr. Wooten.
Naturally, we are concerned, and we voice that every day, is that as we continue to open up businesses, various industries, and increase activities, there is a significant concern that we will see an increase in the number of cases and the number of outbreaks. Hence the reason outbreaks is one of the triggers that has been identified to help us stay alert as to what's going on in the community. So we are very concerned, as everyone should be, and if everyone helps to follow the guidances, adhere to those 4 core strategies, and particularly working on social distancing and utilizing face coverings as necessary, then we will continue to see the great results that we currently see. But if people just throw caution to the wind and not adhere, we will be seeing similar results as are seen in other parts of the country, including Arizona.
You're going to be up there for a while. So this next question is from Alexander Nguyen from KPBS. With the heat wave not expected to let up until Friday, is the county planning to open any cool zones such as libraries, senior centers, or recreation centers?
So the current alert places us in our heat, extreme heat plan in phase 2, and it's supposed to go through tonight. We do have the authority from the state to use our libraries as cool zones. Also, we will have the capacity or the capability to use rec centers also as cool zones. So we will be utilizing libraries and other facilities as defined, as the definition defines for cool zones.
This question from Channel 10 kind of dovetails on the first question. Arizona is seeing a spike in the number of COVID cases. Given the significant number of people who usually travel from Arizona to San Diego in the summer, is the county doing anything to monitor or limit tourism from nearby states like Arizona?
So we have not, throughout this epidemic, limited travel from neighboring areas. The CDC would be responsible for such restrictions. At the federal level, the White House is limited to travel across the border. And there's really no way possible for us to quote-unquote track individuals as they're coming into the county from other jurisdictions unless there are cases and or outbreaks associated with that travel.
And this question is from Mike McKinnon from KUSI. How many of our positive cases were found in asymptomatic people?
I would have to go back. The number in certain populations, I recall 13%, but that's something that we can probably report more fully to you on Friday, unless Dr. McDonald has information.
Sure, I'd be happy to add a couple comments about asymptomatic detections in San Diego. I'd say we're having about 10% of our cases that we report are from individuals who are asymptomatic. You may have seen reports in the newspaper or in the medical literature that up to 30 or even 40% of individuals who are infected with COVID-19 or infected with the SARS-CoV-2 virus might have only asymptomatic infections. And so the fact that we're seeing about 10% or much less than what might be in some of the reports is to be expected, because if people don't have symptoms, they don't know that they have the infection. Those higher percentages come from looking at specific populations, one of which was recently published having to do with the outbreak on the USS Theodore Roosevelt. There were a lot of active duty sailors who were detected because they were testing everyone who had asymptomatic infection. And when we get our reports of asymptomatic infection here in San Diego, they're often because we're testing specific populations, like an entire skilled nursing facility or an entire group of employees when cases have been detected. And we often will find some of asymptomatic cases. We'll find some in households of known COVID cases who were symptomatic, and those individuals were tested as part of an evaluation process. So I think we'll continue to see about the same number as we go forward. As testing becomes more and more available, we may have more people who are tested as part of a program of testing at a workplace or a school or a skilled nursing facility, and we may see more cases that way. But 10% is the average, is what we're seeing, and that's to be expected.
Thank you, Dr. McDonald.
This next question deals with a potential second wave in the fall, and Dr. Wooten will respond.
And this one is from Shalina with KPBS. What are the county's feelings about preparing for the fall? There are a lot of scientific experts who say it will get worse then. What's the plan for that beyond just following the data?
Well, we really don't know what's going to happen in the fall. A lot of experts are saying there will be a second wave in the fall, but we, just like with from flu season to flu season, we never know how bad a flu season is until the flu season occurs. And we look at the results afterwards. So our goal is to make sure that we're ready, and the same lessons and strategies that we use to monitor influenza will be used to monitor COVID-19. As you may recall, two of the metrics that we look at for COVID-19 is influenza-like illnesses as well as COVID-19 syndromic illnesses that present to the emergency room. We are continuing to monitor that on a daily basis now, and we will continue to do that through the flu season. And the difference between, however, influenza and COVID-19 is that we have vaccines for the flu, but we do not, as of yet, have vaccines or a vaccine for COVID-19. So it may be necessary to implement or pull back on some of our strategies or health officers' order measures in the fall, but we will wait until the fall to determine. We know what we can do, but in terms of what's actually going to happen, we just don't know. Thank you.
Great. And this next question is from Kim Miller with ABC 10 News. Do community hot tubs fall in the same category as pools, and how long do pools have to operate at a reduced capacity?
So pools are included in 3 of the guidances that was disseminated by the state. It includes day camps, gyms, and there's a third one. But and it's the same guidance in each of those 3, the same information in each of those 3 guidances. Hot spas, or what was the term you used? Hot tubs are not allowed at this time.
Okay, this one is actually from Morgan Cook with the UT, and it's on that same line of questioning. When swimming pools are allowed to open, will that include pools in fitness facilities and gyms, even though gyms are still closed? What about saltwater and freshwater pools?
So pools, again, were included in 3 of the guidances that have already, well, that would be ready to open up as of Friday, which is June 12th.
This Friday, and they're in the same category as gyms, so it'll be...
Exactly. So pools are in gyms, pools are in day camps, and there, again, is a third guidance where pools are mentioned. So, and that's how we have included a homeowners association pools as well, too. So,
That should answer that.
Yeah.
Okay. This next couple of questions has to do with bars reopening. Are you asking people who go to bars with only people in their household? And they're questioning that because they want to know why that would be allowed when the whole idea behind a bar is to mingle with strangers.
So no, we are following the state guidance. We have not issued any additional guidance related to bars. In the bars for restaurants, and as you know, restaurants, you can have people at your table that are outside of your household. So that same guidance would stand. So I encourage people to review the guidance and follow the directions there. But they are very similar to what is in restaurants, which bars associated with restaurants, they're not opened up just for gathering, but to be associated with ordering food.
Okay, thank you, Dr. Wood.
Well, that concludes our questions for today. We will not be holding a press briefing tomorrow, but we will be back on Friday. Our communications office will be sending out an update tomorrow to make sure you get all the information. For ongoing updates and information, please visit our coronavirus website at coronavirus-sd.com. And until then, please stay safe, San Diego. We'll see you on Friday.